Hey everyone, thank you very much to IFHE for giving us the opportunity to present on this platform. My colleague Rile and myself will be taking you through our presentation on the implementation of a risk scoring approach to manage Legionella in hospitals, a multidisciplinary approach. We thought that we would start with understanding a little bit on what is Legionella. And Legionella is a genus of pathogenic gram-negative bacteria. These bacteria cause illnesses like Legionnaire's disease, which is a severe pneumonia type illness. And this can really be very fatal in our immunocompromised population of patients. It can multiply in man-made water systems such as domestic hot water systems, air conditioners, and cooling towers. Water systems and devices like your shower heads, hot tubs, and cooling towers can harbor these bacteria. Legionella is primarily spread through inhalation of aerosolized water droplets that contain the bacteria. And this really means that people can contract Legionnaire's disease by inhaling the small droplets of water, which is the aerosols that's suspended in the air that contain the bacteria. This can occur in environments where water is aerosolized, such as showers, faucets, or cooling towers. Legionella contamination in healthcare facility water systems poses a significant risk to the immunocompromised patients and staff. Timely identification of high-risk areas for Legionella colonization is crucial for effective management and prevention of outbreaks. This picture illustrates some reservoirs where we can find Legionella. The Legionella species are commonly found in the environment, and they have been found in many different kinds of water and water systems. If you look at the picture, we can see that we can find them in cooling towers, wastewater treatment plants, fountains, bathroom amateurs, medical units, swimming pools, compost, air conditioning humidifier foggers, water systems in soil, rivers, streams, and canals, as well as lakes and ponds. We're now going to look at some of the risk factors for Legionella growth. The first one is stagnant water, which provides an ideal environment for Legionella growth. Areas of the water network that are rarely or infrequently used, such as unused or closed-off wings, low occupancy rooms, or sections of the plumbing system with low flow rates, are particularly susceptible to bacterial proliferation. The second one is temperature. Legionella bacteria thrive in warm water environments. If the temperature of the water in the hospital distribution system is not adequately controlled, especially in hot water tanks, in warm water pipes, or poorly insulated areas, it can promote the growth and survival of Legionella. If you look at the thermometer in the picture on the right, it really breaks it down in terms of the Legionella growth, where we see anything above 60, it's too hot for Legionella to survive. The orange square shows us the Legionella can survive, but it cannot multiply, and this is between 50 to 60 degrees. Our green square shows us that Legionella multiplication range is optimum temperature is 37 degrees. So anything between 20 to 50 degrees is definitely not ideal. And between 10 to 20 degrees, Legionella can survive, but it can't multiply. And then anything below 10 in the lighter blue part is too cold for your Legionella to survive. So therefore, hot water should be stored above 60 and delivered to taps above 50 degrees, and cold water should be stored below 20 degrees. The next risk factor that we will look at is biofilm formation. Biofilms are slimy layers that develop on surfaces in water systems. They are complex communities of microorganisms that stick together and adhere to surfaces. Legionella bacteria can attach and multiply within biofilms, providing them with the protection and nutrients. The picture on the right-hand side of my slide is a cross-section of a pipe, And this shows you how Legionella can live and grow in biofilm. So during construction, including renovations and installation of any new equipment, vibrations and changes in the water pressure can dislodge biofilm and release Legionella or other waterborne pathogens. This can happen when there's any water main breaks, so there's changes in the water pressure or changes in municipal water quality. So therefore, we suggest if there's any repairs or work done on lines or pipes at facility level and where there is water interruption, we suggest that flushing lines for a longer period once the work is completed. The next risk factor is dead legs and dead ends. And dead legs refer to sections of the water network that have little to no flow, such as pipes that have been capped or disconnected. These areas can promote stagnation and create favorable conditions for Legionella growth. The risks are contaminated water sources. If the hospital's water supply is contaminated with Legionella bacteria, it can introduce the pathogen into the water network. This can occur due to inadequate water treatment, contaminated municipal water supplies, or cross connections with non-portable water sources. Construction and plumbing work. So during construction, renovations, or plumbing work, the water system may temporarily be disrupted or modified, which can lead to the introduction of Legionella into the network. And water treatment system issues, inadequate design, operations, or maintenance of water treatment systems, such as cooling towers or water filtration units, it can contribute to Legionella contamination. These systems should be regularly inspected, cleaned, and properly disinfected to minimize the risk. I'm now going to hand over to my colleague Rile to take you through the water management program.
After taking all of those risk factors about Legionella into account, we then had to establish a water management program. So we started with establishing a water management committee or a team with designated roles and responsibilities. After that, we did water system mapping of all the facilities and then conducted risk assessments. A collaborative multidisciplinary approach is critical in establishing an effective system. The team plays a crucial role in managing water systems to prevent Legionella outbreaks in healthcare settings. The infection prevention practitioner is part of this committee. They will help identify high-risk areas for Legionella growth, review the current water management practices to determine potential gaps in infection control, recommend effective control measures such as temperature monitoring and flushing protocols, work with facility management, engineering, and maintenance teams to ensure effective implementation of water management strategies, participate in investigating potential Legionella outbreaks, including tracing sources and implementing control measures, help develop and activate emergency response plans when Legionella is detected, and regularly review and update the water management plan based on new evidence, guidelines, or facility changes. The technical service manager should also be part of this committee. They oversee the operation and maintenance of all water systems, including hot and cold water systems and cooling towers. They evaluate the physical state of plumbing systems, identifying areas that may contribute to Legionella growth, such as dead legs or poorly insulated pipes. Temperature control, water treatment protocols, for example, with chlorine. Conduct routine inspections of the water systems. They coordinate and oversee the collection of water samples for Legionella testing, ensuring adherence to established protocols, and they work closely with infection prevention practitioners to align technical operations with IPC principles. Nursing manager and unit managers forms part of this committee. They assess and monitor patient populations that may be at higher risk for Legionella infections, such as those with compromised immune systems. They work closely with IPC and technical manager to align nursing practices with water management protocols. They participate in the facility's outbreak response plans, and they contribute to regular evaluations of the water management plan, providing insights from nursing staff and patient care experiences. Nursing is the link between the committee and the patient. So if the technical managers need to increase the temperatures of the hot water, they will need to communicate to the patients that the water will be more hot or hotter than previously so that they don't burn. The hospital manager is also part of this committee. They facilitate collaboration between various departments, including IPC, maintenance, nursing, and engineering, to ensure a unified approach to water management. They engage with external stakeholders, including public health authorities, to stay informed about best practices and regulatory changes. They also oversee regular assessments of water systems to identify vulnerabilities and potential sources of Legionella growth. They will also communicate to doctors, for example, that if there's an area that tested positive for Legionella, that the doctors can assess their patients to see if there's any signs and symptoms of their patients and if they need to be tested or not. The water management committees were established. Water system mapping needed to be done. So that is an up-to-date drawing of the domestic water reticulation system. And on this map, we also identified where immunocompromised and high-risk patients are, low occupancy areas, or where taps and outlets are not used often, previously positive areas, as well as where hot water temperatures were below 50 degrees Celsius or cold water was above 20 degrees Celsius. It's important when you decide to take samples for Legionella that you also take into consideration the proximity to patients and staff. So prioritize sampling points that are near patients and staff, for example, showers, baths, flushing of toilets, hand wash basins, etc. So this is how a water system mapping might look like. So you need to identify if there's different floors in this hospital or healthcare facility. You need to identify the cold water supply tanks, the hot water supply. On this map, you can see that it's on the roof there at the top. Then the clinical areas on each floor, as well as you can see the keys at the top of this slide. We identified areas with low use taps, showers or baths, immunocompromised or high-risk patients, if cold water temperature was above 20 degrees Celsius, if hot water was below 50. We also identified areas that previously tested positively for Legionella, current positive Legionella testing, as well as where areas that where it was not detected, and low occupancy units. So you can see on this map, it's quite busy, but if you dissect it a bit, it does make sense. After we did the water system maps, we conducted risk assessment. And this is the system that we came up with. So the criteria we took was the water temperature, low occupancy, if it previously tested positive, as well as the areas with immunocompromised patients. And we gave a scoring, as you can see, on the screen, and then the legend, if the scoring in total was 0, it was a low risk area. If it was 1 to 2, we marked it as moderate risk, and if it was a score above 2, it was a high risk score. So this is what it looks like for the hospital that we did 2 slides back for that mapping. So if we gave those scores according to our legends, the general unit, NICU, PEDS unit, and PICU were identified as high risk, as they had previously positive results, as well as immunocompromised patients, and the general unit also has low occupancy that gave us the score on this slide. Taking that to the map, you can see in red circled the NICU, General Ward, Peds Ward, and PICU. Those were identified as our high-risk areas, and now we can do targeted intervention in those areas to mitigate the risks and to make sure that we don't have Legionella in those areas anymore.
Thank you, Lilian, for taking us through the risk assessment as well as the water system mapping. Once we identified these risks, we then had to put in preventative measures and a monitoring system. So a maintenance plan of the water system for each facility was designed according to the risk assessments and collaboration between infection prevention and control and technical departments. Our maintenance plans varied from review the domestic hot water reticulation temperatures to ensure that the hot water storage temperature is above 60 degrees and cold water was below 20 degrees. The hot water temperature in the supply piping leaving the storage vessel is at least 55 degrees, and on return temperature back to the storage vessel is above 50 degrees. This was not always easy to achieve, especially in larger facilities or older facilities where we've had plumbing issues. Hot water reaches any hot water tap within 30 seconds from the opening of the tap. Fixing of our water systems where needed. We looked at our heat pumps and our circulation pumps. All dead legs should be removed or flushed at least weekly. Flushing of taps, and this was especially important in low occupancy units. Changing or cleaning of shower heads and tap sieves. And then the chlorination of the water system. So each facility has its own chlorine dosing system that they monitored. I'll now hand you over back to Lilian, that's going to go through our conclusion of our presentation.
In conclusion, Legionella control is a multidisciplinary effort involving collaboration between technical staff, IPC, specialists, and relevant stakeholders within the hospital. A systematic approach to identify and manage Legionella in healthcare water systems, prevent outbreaks, protecting our vulnerable patients. Proactive measures reduce contamination risk, ensuring patient safety and staff safety. Continued vigilance and regular monitoring maintain water system hygiene, minimizing the threat of Legionella-associated infections. Regular communication and coordination among these teams are crucial for effective Legionella prevention and management. We also want to acknowledge and thank Dr. Caroline Maslow, who's our Senior Medical Advisor, Yaku Ras, our National Technical Manager, Adele Kulane and Madeleine Meyerberg, who's our colleagues, Regional IPC Managers, the Netcare Infection Prevention Practitioners, as well as Technical Managers. Without any of you, this wouldn't have been possible. Thank you very much. And thank you for this opportunity.